The topic for this video is pain. Just the mere mention of the word pain is likely to bring up many different emotions: anxiety, fear, and perhaps some helplessness. Does it have to be this way? Are there ways to deal with pain? Let's find out from some experts. Welcome to this next segment of Wellness Cues. I'm really pleased to have Dr. Ganesh Balu, a really renowned pain management expert with practice in Dover, Delaware, and Wilmington, Delaware as well. And also we have the pleasure of having Sandy Gloss. Sandy is a registered yoga therapist, and I'm really delighted to have them both join us for this conversation on pain. So let me start with you, Dr. Balu. What kind of pain do patients come to you normally, right? On a typical working day, what are the kind of pain issues that you deal with?
Thank you for having me on this video. Most patients who come to us have pain longer than several weeks to months. Patients have a lot of reasons to experience pain. So we understand that pain is a common experience most of us experience through our lifetime. The acute pain or immediate pain usually goes away, and when the pain stays in our body long enough that it's more than 3 months, we call it chronic pain. Most of our patients come with chronic pain.
And that's when they start getting worried about the pain and
that's
how to deal with it.
That's
now,
correct.
What kind of where in the body are they having this pain? What are some of the common ailments that people come with?
Okay. Most of the time in our practice, we see patients with neck pain and back pain, but we do see patients with musculoskeletal pain affecting other parts of the body, generally the other joints like shoulders, hips, ankles, knees, and also wrists.
So the phrase pain in the neck has some substance to it, right?
I agree.
Neck pain is an issue. Now, what are some of the things that people can do to prevent or minimize the chance of pain manifesting in the first place?
For acute pain patients, they already know to take rest. They generally use heat or ice, and a lot of times they would have taken over-the-counter medications like Tylenol or ibuprofen, sometimes a topical Biofreeze, for example. But when the pain is not getting better, that's when they reach out to specialists like us to see what is the underlying condition or diagnosis.
Yeah. Let me turn to Sandy now. Sandy, pain comes from injury. And is it possible that lifestyle could play a role in this? And are there things we can do to minimize the chance of injury and therefore pain?
Lifestyle is a huge component of pain. As people age, I think a lot of people don't realize how many muscles we have and how many we don't use. The average person has 640 to 650 muscles, and if you don't use those muscles, they're going to atrophy, and you're more likely to have injury when you're out of shape.
Right.
So there's a lot of things you can do to help to get those muscles in shape, and if you've had an injury, also trying to tone up the muscles around the injury to support, maybe it was your back or your neck, to give you better support.
Great. So now Sandy is going to show us a couple of very simple exercises that could help on a routine basis to minimize the chance of injury happening.
Okay, we're going to do a pose to warm up our back. Come onto your hands and knees and palms underneath. We're going to look at our belly as we lift our back up, and then we're going to inhale as we look forward. Exhale, look back. Inhale, look forward. Exhale, back. Inhale, forward. And then we're going to come down into another pose called the child pose. You're going to sit back down on your heels, put your hands out in front, and lower your head to the floor. You can put your hands as far as they will go. If your hands only come this far, that's fine. Or stretch them as far as they'll go
and hold this stretch. This is a really good stretch for when you're in pain. It takes the pressure off your lower back. And breathe.
And that's the child pose.
Okay, Dr. Baloo, can you expand a little bit on the quality of life? What patients go through when they come to you with pain?
So that's a good question. Pain is a very sensory experience or an emotional experience. Different people respond to the same amount of pain differently. For the most part, if it is a pain that people have experienced and it's a self-limiting, most of the patients do well and they forget about it, and they might go through certain treatments during the pain experience. For the most part, it's history and it's forgetful. But when the pain becomes chronic and certain group of patients experience it more than others, their life experience will be a lot more altered. Their quality of life will be a lot more curtailed.
It's going to affect their work schedule, perhaps, their hobbies, right?
Correct. Their interaction with their family members, friends, their ability to involve in day-to-day activities, whether it's at home or outside the home, their ability to go back to work, and their ability to enjoy a day-to-day life in general.
Right. So it's appropriate to say that there is a mental health component to the pain experience, right?
Yes, definitely. There is a significant mental health component in patients' pain experience, and also how they get better.
Right, right. So I want to come back to that in a second, but maybe we can start by talking about pain management. So you mentioned that people with maybe several weeks of pain, they come to you. So how do you manage these patients? What kind of interventions do you offer?
Sure. First is, we offer them good education. So education a lot of times settles down their doubts. And
so education about
their physical health, muscles, tendons, and how the injury happened, and is there a road to recovery, and whether they did what they're supposed to do, whether it's rest or stretch or strength or take medications on an as-needed basis. So when the pain is not getting better with the usual types of treatments that patients would have tried, which is generally that might include physical therapy also.
Physical therapy.
Then we are here to monitor more their therapy program that we offer in our office. In addition, we might change their medications. Maybe it's a prescription strength medications. Sometimes we offer them topical medications to help them heal from their injuries. Occasionally we ask them to try spinal injections or joint injections or tendon sheath injections. And of course we offer them x-rays, CT scans, MRIs, the tests that will show how bad is the pain, where is the pain. And at times we also refer them to surgeons because they're not getting better with our interventions.
So there's muscular pain and there's perhaps neuropathic pain as well.
Correct.
Right. Okay. So when these conventional, or should I say traditional, approaches to pain management, I'm sure that helps a lot of patients, but there could be situations where you could supplement it or maybe add something more to it, and that's what I would refer to as more holistic practices for pain management. Maybe you can shed some light on that.
So when we say holistic, or when you use the word integrated or comprehensive, the patients are being treated under one roof. Patients in our practices get to see a physician, a therapist. It could be an athletic trainer, a chiropractor, a massage therapist, a counselor, and also a yoga therapist or a nutritional therapist. So when we bring all this together, the patient's ability to get better is much warranted because they are getting the same type of reinforcement in terms of whether it's physical exercise, whether it's diet modification, whether it's routine stretching and strengthening exercises they're going through. So the whole idea is we are treating the patient as a whole, and there's a team of experts helping them to get better.
Okay, that's great. Okay, Sandy, so we touched on mental health component and alternative or holistic interventions for pain management. So can you speak on that? For example, as a yoga therapist, how do you see these approaches and what different approaches you use and how they actually benefit the patients?
Thank you for asking. I tell you, it's been a pleasure to work out of this office because, as Dr. Ballou said, they offer different things here, and it really is an amazing place because you don't find very many doctor's offices that really try to take care of the entire person, from nutrition to breathing to he even has you even can get mental therapy. So it's an incredible team to be a part of, and really good communication because we get to talk to each other, and you don't see that in a lot of other doctor's offices anywhere in the United States, really.
That's fantastic.
It is, it's incredible. But as far as getting back to your question, then you wanted to know.
Yeah, let's start with yoga. I mean, I'm imagining that many of these patients coming in, that they may not even be able to lie down on a yoga mat, right? Leave alone doing some extensive yoga postures. So how do you deal with these subjects?
So this is more common than not. I think most people, especially as we age, we think, oh, we can't do yoga. People have this idea that yoga's you twist and turn and you do all kinds of things. But actually the people that benefit most from yoga are the people that have had injuries, that are aging, and that are out of shape. And I encourage people to come and try a half-hour session. Most people, when they first try it, they don't think they're going to like it, but they end up feeling pretty good afterwards, and it's a great experience.
And then they come back.
And then they come back, yes.
Okay. So you're going to show us some postures sitting on the chair in a minute or so, right?
Yes, I am. But before I show the postures, I wanted to mention something about the breathing and the meditation.
Yes.
Because that's another important part of yoga, which I'm not going to show in detail, but it has so many other benefits. And I'll tell you, when I started training in yoga, I started doing some of the breathing techniques. I do them every day now. I do them before I go to bed. But I find that I do the breathing techniques before every time I go to the doctor's office, before I see the doctor. It calms you down. It decreases all the stress on your vagus nerve.
Sure.
And it's just there's so many other benefits, including it helps increase your mental clarity. It cuts down, if you're focusing more on your breathing, you're not going to be focusing less on pain. So it does help you to decrease pain. And they also have studies that show it increases the good chemicals in your brain that help you to feel better.
The neurotransmitters that help you, maybe the dopamine type neurotransmitters.
Exactly.
I can tell you anecdotally to both of you that I've been teaching these breathing techniques for several years now, and I've come across people who had some surgery maybe a few months back, and they come in with significant burden of pain. And they tell me after a few months of practice of breathing technique that they are a completely different person. So I can kind of relate to what you're saying about bringing this into pain management.
Oh, and it helps with sleep too.
Sleep.
I always do the breathing before I go to bed because my brain bounces all over the place, and it just really helps slow you down and let your body relax and fall asleep.
Wonderful.
Okay, I am going to talk to you a little bit about yoga. There's different ways to do it. A lot of times it's done on a mat, but you can get all the benefits from yoga using a chair or even lying on a bed. And I brought with me 2 blocks today. I just got these at the dollar store. You can use blocks, they help, or you can use a box or books. But we're going to start out with the child pose, which is a great pose if you're dealing with a lot of pain. So you put those blocks on the floor next to your feet, and we're going to, you can put them at different heights. We're going to put our feet on the blocks, and we are going to bring our knees up as high as we can. We're just going to hold, relax the arms down, and hold that stretch. Now, as you do yoga more and more, you get more and more flexible. Maybe you'll be able to increase the blocks, put them higher and higher. Maybe you'll be able to bring your leg all the way up to your chest. But basically, you can still benefit wherever you're at as long as you're feeling a nice little stretch and relief on your back. And this is the child pose. So the next pose I want to show you is to help prevent pain, and that is the cat-cow. So the cat-cow, we don't need the blocks. Basically, you're just going to put your feet shoulder-width apart on the floor, And you're going to put your hands on your thighs, and you are going to take your chest, pull the shoulders back, open the chest up as you inhale, and then you're going to lean forward and exhale. Open the shoulders up, inhale, lean forward and exhale. We'll do that one more time. Inhale, shoulders back. Exhale, shoulders forward. That little motion is so important for your spinal column. It helps get all the fluids flowing around all the discs, and it warms your back up. Really important to do before you start your day, before you do anything strenuous, to help prevent problems. So that's the cat-cow. I also want to show you the knee to the chest. So the knee to the chest is, everybody sees this at all the sports events. People put a knee to their chest. Why? Because it warms up their back. So we can do that while we're sitting in a chair. You can use a block if you want, or you can just lift your knee up to whatever height you can. Everybody has a different height. There's no judgment. Doesn't matter where your height is. If you do this regularly, you'll be able to get that knee up higher and higher and higher. But if your knee only comes down to here, that's fine. So basically, you put it up there, you hold it, and pull it in towards your chest, and this is the knee to the chest pose. And then you would do it on both sides, and that will help warm your back up. Those two poses are very important to do before you do anything strenuous.
So in closing, Dr. Balu,
Yes.
I want to touch on this one point, fear. Many patients undergoing pain have this element of fear, which sometimes the people say is worse than the pain itself. So what can you tell about the fear component?
Right. So the patients, as we talked about, it's a sensory experience. More than fear, they have anxiety. The anxiety translates to fear that they don't want to do their routine activities,
Yeah.
whether it's enjoying their day-to-day life, enjoying their hobbies or working, because of the fear or the anxiety that pain brings in, because they know that they'll not be able to complete that activity, or they'll be suffering through that activity,
Right.
or they might be hurting more than their baseline by doing that activity. So for that, we want to, of course, educate the patient, have them realize that there are limitations, some lifestyle modifications. For example, a person who was building bridges or construction may not be able to go back to that type of work where they have to lift heavy objects. So that is a lifetime modification that they have to go back to light duty. And also on day-to-day activities, they have to think through what is happening, and they have to use proper body mechanics. They probably need to stretch and strengthen their body on a regular basis and go through some warm-up stretches before they...
Yeah, warm up. That's really important, right?
Right.
Yeah.
So warm up before they involve in that activity, and also be part of a chronic or a long-term program where they're getting the treatment or they are involving themselves in a therapy program that is comprehensive enough that they prevent further injuries. And also understand that since it's chronic, it may not be curable condition.
Can be managed.
Correct.
Be managed enough so you can at least resume some of the activities
Correct.
that you enjoy.
Correct. So they might need to take certain medications or certain therapies, or be part of a holistic program like acupuncture, massage therapy, chiropractic therapy, including yoga therapy that we don't usually think about. And also there's a lot of advancement in pain medications,
Yeah.
pharmaceuticals. There is advancement in injection procedures, or sometimes referred to as minimally invasive procedures, or even surgeries. They're getting, all the surgeries are getting simpler and smaller instrument, smaller incisions, and quicker recovery. So patients should not feel disappointed. They just have to go to the right place to get the right treatment.
Fantastic. This is very encouraging. On that note, I want to take the opportunity to thank Dr. Balu
Thank you.
and Sandy for this wonderful informational session, and I hope everybody who watches this will get something out of this. Thank you.
Thank you.
Thank you.